Applying proven techniques to pass NCLEX-RN exam at first attempt. The National Council Licensure Examination for Registered Nurses, NCLEX-RN, is a challenging test that determines whether or not you are qualified to become a registered nurse. After rigorous classwork and clinical rotations, the last hurdle is to pass your NCLEX so that you obtain your license. Getting over this hurdle is the door to achieving your dream as a registered nurse. Passing the NCLEX-RN exam on your first attempt can be a daunting task, but it is definitely possible with the right preparation. In this video, I will share with you some proven techniques to help you pass the NCLEX-RN exam on your first attempt. Technique number 1. Understand the test format. The first step in passing the NCLEX-RN exam is to understand the test format. The NCLEX-RN exam is a computerized adaptive test, CAT, that uses a complex algorithm to determine the difficulty of the questions you receive. The exam consists of multiple choice questions, fill in the blank questions, and select all that apply questions. It is important to understand the format of the test and practice answering questions in the same format as the NCLEX-RN exam. Technique number 2. Before your exam date, create a realistic study plan. Creating a study plan is essential to passing the NCLEX-RN exam on your first attempt. A study plan can help you stay on track with your studying and ensure that you cover all the topics you need to know. Your study plan should include a schedule that outlines the amount of time you will spend studying each day, the topics you will cover, and the resources you will use. You should also set specific goals and deadlines for yourself to ensure that you stay on track. When creating your study plan, make sure to include breaks and time for self-care to avoid burnout. Technique number 3. Use high-quality study materials. Using high-quality study materials can help you prepare for the NCLEX-RN exam. There are many resources available, including textbooks, study guides, online courses, and review books. Make sure to choose study materials that are specific to the NCLEX-RN exam and are from reputable sources. Look for study materials that are updated regularly to ensure that you are studying the most current information. It is also important to choose study materials that match your learning style, whether it's visual, auditory, or kinesthetic. After you are satisfied with content review, get a question bank such as UWorld or Kaplan. Tip: while answering questions, read every rationale and understand why you passed or failed. Get a memory strategy. There will be so many things to memorize. Some of the ways to easily retain content include: use mnemonics e.g. OOTTAFVGVAH, UTUFVGVA, for cranial nerves. Write notes on stickers and put them by your bedside. Look at the notes every night before sleep. Visualize notes as you read them. For example, as you read about Cushing syndrome, form a picture of a Cushman, and see how he would appear with those symptoms. Form associations e.g. a drug lorcetin. See Satan blocking your friend angiotensin II. You can use Mark Klimek review notes. They also have some good memory tricks. Technique number 4. Practice, practice, and practice. Take practice exams. Taking practice exams can help you get comfortable with the format and difficulty level of the NCLEX-RN exam. There are many practice exams available online or in study materials. Try to take practice exams in a simulated testing environment, with a timer and no interruptions. After taking the practice exam, review your results to identify areas where you need to improve. Make note of any questions you got wrong or weren't sure about, and study those topics more thoroughly. Technique number 5. Manage test anxiety. Test anxiety can be a significant barrier to passing the NCLEX-RN exam. To manage test anxiety, practice relaxation techniques such as deep breathing, meditation, or visualization. Make sure to get enough sleep the night before the exam, and eat a healthy breakfast to fuel your brain. During the exam, take breaks if needed and remember to stay calm and focused. If you feel yourself becoming anxious or stressed, take a few deep breaths and refocus your attention on the exam. By using these proven techniques, you can improve your chances of passing the NCLEX-RN exam on your first attempt. Remember to stay focused, stay positive, and give yourself plenty of time to prepare. Good luck on your exam!